Greetings and welcome to this 2-week training of ICD-10, CM, and PCS. My name is Stacy Hairston, and I am the current ICD-10, CM, and PCS content expert at Pomfrey Consulting. Throughout this lecture, you will learn an overview of the ICD-10, CM. We will go through several things to give you the background and the overall understanding of coding. If you're new to coding, this lecture will definitely be your guide to excelling in your current position. And even if you are experienced and have been coding for a while, this lecture series definitely will give you some of the key information that you need to become a better coder. The objectives within this lecture will be first to define medical coding, provide an outline of the benefits of why ICD-10-CM is used, describe some characteristics of ICD-10-CM to give you that foundation of when we come to and talk about procedure coding, the differences in how ICD-CM will be identified as well as used, describe the organization and structure of ICD-10-CM. So when we're looking at the actual code book, how you should be going about the code book and understanding the different sections within the code book. And then we will discuss the process of how the code book is actually used. So how are codes being assigned? If you're new to your position and understanding medical coding, the idea for medical coding is to, when you're using this ICD-10 CM code book, is to transform that documentation that's stated by a physician of the diagnoses, what procedures the patient had, even the actual equipment, taking all of that information from the patient's medical record and then transporting that into alphanumeric codes that are used universally throughout healthcare. Coding is used for several purposes. So those alphanumeric characters that you've identified from the patient's documentation is then transported and used, first of all, for reimbursement. So a lot of the information that you will learn over these 2 weeks when it comes to using ICD-10, both CM and PCS, is based upon how those claims would be processed based upon coding guidelines and other standards and rules that would be applied to get the reimbursement for those services. The other key things, and one of those being very important for trauma registrars, is taking those universal alphanumeric characters and transporting them into information that would be used for tracking and managing public health risk, as well as other processes that would in the end improve that patient's care. So when it comes to designing or developing new delivery systems or setting healthcare policy, those codes that are identified is that universal way of how all healthcare organizations and providers are able to use that information to make a difference when it comes to the patient's quality of care. In reviewing the history of how medical coding started, we can go prior to October 2015. The United States utilized ICD-9 CM, and there's a long history of how medical coding began, and it began back in really, um, I would say my history of learning it started back in the 1800s, but in 1970, ICD-9 CM was implemented and used within the United States. That was used until October 1st, 2015, when ICD-10 CM was implemented. So it was used for many years. And it was updated in the fact, I'm going to review that over the next few slides, that there needed to be a better way to classify diseases in more of a specific way. The WHO, which is the World Health Organization, actually publishes ICD-10. And ICD-10 is used throughout the world. that is used to classify diseases, specifically how individuals die. ICD-10-CM, specifically that CM, and I'm going to get more into detail around that on the additional slide. Notice it's specifically for the United States. So ICD-10 is used in other countries, and it has been used throughout the world. Specifically, that CM part, and I mentioned it meant clinical modification, is unique to the United States. So within the United States, we do practice healthcare in different ways. We classify different conditions and diseases sometimes differently than throughout the world. And so the United States has modified the ICD-10 classification to specifically how we practice healthcare within the United States. So when you see ICD-10-CM, that is specifically for healthcare within the United States. Throughout other countries, just to give you guys some examples of how other countries have also modified the ICD-10, so how the world classifies different diseases and diagnoses. Australia, for example, they modified within 1999 the classification for ICD-10 to AM, okay, specifically to Australia, as well as Canada. Canada as well has modified ICD-10 to CA, specifically for how Canada classifies different diseases and diagnoses. So if within the United States, it doesn't matter if you go state to state, okay, it's still the same because it is that clinical modification for the United States as a whole. Now let's talk about some of the benefits of using ICD-10-CM. First of all, the ICD-10-CM is providing greater specificity. So you're able to be very detailed when it comes to identifying the disease as well as the circumstances around that injury or that diagnosis. It allows for possibly a greater expansion of code numbers. So as we start getting into the actual characteristics of ICD-10 and talk about the actual organization and structure of the actual code, you will see how that code has been expanded. If you've had knowledge on ICD-10-CM, then specifically you will see how the code allows for, in the future, for adding those additional details around a diagnosis, or kind of how a disease can change. And there are several different areas of that disease that then could be identified and picked up and tracked. We're then able to expand that within that code. It would extend beyond the simple classification of a disease and actually maybe include risk factors or the frequency of that encounter. So for example, if a patient comes back for a subsequent visit, we're able to identify that, or if it's the first time that a patient comes in for a certain condition, ICD-10-CM allows us to identify that. And please note, and this is probably the major thing that's so important, is it is updated and consistent with terminology that is currently used within healthcare, which is so critical when you're trying to review that and identify that through the patient's documentation. If we get into the characteristics of ICD-10-CM, the first thing is to know that the code itself is going to be alphanumeric. All of the characters within the alphabet are going to be used except for the letter U. That code can be a minimum of 3 characters, or it can also be up to a maximum of 7. Many of the codes that will be used for trauma specifically will be 7 characters. And so it would be very important that all 7 characters are identified to make sure you have identified that diagnosis to the highest level of specificity so that you have the most detail as possible. Groupings by categories of injury or type of wounds. You then can group injuries by site and even by type. So we see how very specific. The other key thing that's going to be very important within that listing of characters, whether it is a minimum of 3 or a maximum of 7, will be the laterality. So identifying whether the patient had that injury on the right or the left side, or was it bilateral? So the key things that can now be picked up with ICD-10-CM. The other key thing is something called a placeholder, which is going to be identified within those characters as the letter X. And this is important that in the future, those X's then can become characters. So it allows for expansion of the description of that disease or injury within the code. So in the current version, so for example, in the 2022 edition right now, there could be an X, but then maybe in the 2023 edition, that X then becomes a character that actually identifies something more detailed within the diagnoses. The other key characteristic around ICD-10-CM is something called combination codes. This is where you could have one code that would also be grouped with the etiology, so the cause of the disease or the manifestation. So a combination code is that it's only one code. However, it will then include all of this other information within one code. And we're going to talk about how you identify that, and that would be identified when we get into the discussion of the organization of the code book and how it's used in order to know, is it just one code that could be a combination code, or would there be multiple codes that then could identify the etiology along with the manifestation? The last point that's so important, that's a great addition to these ICD-10-CM codes, is going to be the 7th character extension. So I mentioned earlier that when we were talking about the benefits of these codes, and one of those great benefits is that 7th character extension, which does allow you to identify if it's the first time that a patient had that encounter, or is it a subsequent visit. Many of the trauma specific codes that you will identify would have that initial encounter 7th character extension, which is so important to say the patient came through the emergency room or whatever the circumstances were to show this is the first time that we are seeing this within this facility, that this patient had this particular diagnosis. If we get a little bit deeper into the examples of the characteristics of ICD-10-CM, it will be organized in the following manner as far as how it is formatted. Characters 1 through 3. So remember I stated on the previous slide that in ICD-10, CM code can be from a minimum of 3 characters to a maximum of 7. The first 3 characters are going to be known as a category. So it's important you kind of note these. If you're new to coding, or if you have been coding and have not really gotten into the correct terminology, write it down as we continue throughout the next 2 weeks in the lectures that will follow. I will be referring to these terms, such as the category, or going into more detail of the actual 7th character extension, etc. So just kind of note that terminology so you can follow throughout the rest of the lectures. So the first 3 characters will be the category. Remember, all codes definitely are going to have a category because it could be a minimum of 3. And the category is going to identify really the area of the body of where the injury, the type of disease or injury or whatever has happened, and then potentially where that could be located. So for example, S52, the category means fracture of the forearm. In addition to those first 3 characters, you then could be followed by 4 through 7. So if we look at 4 through 6, those codes that will follow the category, those characters could identify the etiology, so the cause of the disease, the anatomic site, so specifically where, the severity of the injury or the disease, and any other clinical detail. So each of these characters, this is why it's important to code to the highest level of specificity, because each of these codes will identify some specifics of that documentation. From there, so for example, if we look at the 4th through the 6th characters, the 5th character is identifying it is the fracture of the lower end of the radius, which is the anatomic site. The 2 could identify more clinical detail in addition to the anatomic site. And then we have our 6th character is identifying the laterality. So we can identify the type of fracture, it's the lower end, and it was the right radius. We then have our character 7, which always remember the character 7 is going to be the extension, and identify that additional information around that disease or that injury. So for this case, we're going to use A. And as we get into the additional lectures, you'll learn kind of some more of those 7 character extensions and what they would mean and how to identify those. So the 7th character here would be A, and it identifies the initial encounter for a closed fracture. It is very important, notice that this actual identifying this diagnosis requires 7 characters. We need all 7. Each of these has a meaning, and it is so important. So it requires a greater specificity, and you have to have that clinical documentation to support each of the codes that you have identified. So each character has to be identified through that documentation. The organization of ICD-10-CM would be in the following 2 parts. It's not going to matter which publisher you have. Each of the code books will be organized in the same manner. The code book is going to be divided into 2 parts that each of those 2 parts will have 21 chapters. The first is going to be the alphabetic index. So the alphabetic index usually at the beginning of the code book. So at this point, I always like to tell participants that you should have a hard copy of the ICD-10-CM code book. And when I mention hard copy, it's you actually have the code book in front of you. I know many facilities do use an encoder. However, it is very important to understand how the actual code book looks and the format of that code book when it comes to the descriptors that are used around the different diseases and injuries. This also helps you navigate within the encoder a whole lot better. So if you haven't had any experience with the actual ICD-10 CM code book, it's very important that you actually get your hands on one and use them. And I highly recommend it that you're using it throughout this course. If you open up your ICD-10 CM code book, so I'm going to pause a minute to allow people to get that code book. If you don't have it in front of you, always remember you can hit pause and get the items that you need and then come back and hit play. So within that code book, you're going to have 2 sections. You're going to have the alphabetic index, which is usually listed in the front, and it is going to be divided and organized, I should say, within alphabetic order. So you will see the actual diseases and diagnoses listed in alphabetic order. Some other things within that alphabetic index are going to be a couple of tables. One of those tables would be a neoplasm table. If you are coding for cancer or any other types of tumors, then that is very helpful in using that table to code them. The other table that you will see will be the drug and chemical table. This is a table that will be used through coding different injuries and diagnoses for trauma. So we will have some experience going through the drug and chemical table within the additional lectures that we're going to walk through within this course. Then at the end of the alphabetic index, you will see a section that is listed as the external cause codes. This section, we do have a lecture where we go through the external cause codes, and we will be using that section within detail. However, please note all of these parts do make up the alphabetic index. The second part of the ICD-10 CM code book will be the tabular list. So the tabular list, notice, is in a different format. Versus it being in alphabetical order, it is actually in numerical order as the codes, okay? And that is also dividing into actually the different chapters as well of the code book, okay? So you would see that it may be divided into the section looking at blood, infection diseases, or blood conditions, etc., even injuries, and you'll notice that within the tabular list is going to be divided within those categories. Okay, so remember I mentioned earlier that categories are the first 3 characters of the code, and that kind of lets you know where you are as far as within the body system as well as what that condition is. The categories are going to be divided into the following organization within the code book. And these are going to be the different categories within these ranges that then will let you know, well, where am I when you look at that code? Because these categories don't change. They may be enhanced, but however, for example, anytime you assign a code between C00 through D49, you know you've identified some type of neoplasm. And so this gives you a listing, and this is going to be all the 21 chapters that are listed within the ICD-10 CM code book. Continuing on, notice all of the categories here. Okay, for example, anytime you code within the categories of O00 to O9A, immediately you know that those are codes that are assigned when it comes to the patient being pregnant, childbirth, any of that, any of those type of diagnoses will fall within that range of code. If you ever assign a code and it's not in reference to a pregnant patient, therefore you know you have the wrong code. So actually getting familiar with these ranges of codes and what the actual disease is very important. And it's kind of, to me, like a double check in the fact of making sure you're using the correct range. For trauma specifically, and for this course, over the lectures you will be hearing, we're only going to be focusing on, from those 21 chapters, 2 chapters. And those 2 chapters are going to be chapter 19 and chapter 20. Chapter 19, the range of codes will be S00 through T88. Those codes would identify injuries, poisoning, and other consequences of a condition. Okay, so this is where we're going to sit when we are going through different examples and walking through the code book. The other chapter is going to be chapter 20, and that range of codes is V00 through Y99. These are going to be those external cause codes that I talked about that do have a section within the alphabetic index within the ICD-10 CM code book. So we do have a lecture walking through chapter 20 and how you would assign those external cause codes. So remember, for trauma, and what you will be learning within these lectures will be focused on chapters 19 and chapters 20. So get very familiar with the range of codes. And note that if you assign any of those other ranges of codes that are not specific to trauma of what we're looking for, then note maybe you're in the wrong location when you are locating the correct diagnosis code. Now, to review, when we talk about the entire spectrum of coding, we have mainly been focusing on the CM part, which is the diagnosis part, which I've kind of walked through of what is CM. The other part is going to be the PCS codes, which are your procedure codes. So I mentioned you should have a ICD-10 code book. You actually should have 2. The first couple of lectures that you're going to listen to are going to focus specifically on the CM part, and that is going to be identifying diagnoses. So here, going to the table of CM, you see we have diseases and diagnosis codes. You'll also be identifying those external cause codes from that CM code book. And remember that when we identify diseases and diagnoses, that also means if the patient has a primary condition, and then if there is some other secondary condition that potentially may need to be identified, such as asthma, diabetes, or something, if that's something else that you are picking up, those codes are also identified with the CM code book. The other code book, and we'll get into this later within the lectures you'll learn, is how to code procedures. So there will be a code book that will be used to identify procedures, and we will have a lot of fun going through ICD-10 PCS. To go a little deeper into those diagnosis codes and what you will be identifying, if we move into the specifics that you'll be picking up for the trauma registry, the first box identifies the nature of the injury or illness, including any pre-existing or comorbid conditions. So the top box and the bottom box pretty much goes together, where you're picking up all of those conditions, even if there could potentially be some complications. The other thing to note is that the National Trauma Data Standards will be followed using these diagnosis codes that you would be picking up as well for the CM portion. External cause codes, that should give you some context around the definition, is that these codes capture the circumstances of an injury. This will let you know and use to monitor any changes in patterns and what causes an unintentional injury and assault. If a person has done some self-harm, so for example, if a patient fractures their femur, okay, for example, maybe they fractured their femur because they were riding on an ATV. Well, that riding on an ATV would be something that would be picked up as an external cause code. So this would be part of the billing process. Sometimes, depending on your facility, there could be some training on specific things that need to be identified and picked up. And we're going to talk about that when we have the lecture on external cause codes. But for those that are new to really learning coding, I wanted to just put it into some context, the different parts that I've already discussed of what's located within this ICD-10 CM code book. Note that these codes are updated every year. It's very important that you use the most up-to-date version. We do have the 2022 version that is available now. So you definitely should be using that. If you're not, at least be sure of what those changes and updates are so that you're not using the incorrect code. If we get a little deeper into PCS, so remember, this is just the overview of coding and what you can expect over the next couple of lectures. I mentioned that PCS is specifically for procedure coding, and those procedure coding can be broken down into three groups. Diagnostic, which would be identifying if the patient had a CT, an MRI, therapeutic, what was done maybe to treat the injury or the disease. Did the patient receive a blood transfusion, whatever else? And then intervention. Was an X-lab performed? So did they kind of go in, what surgery was performed, etc., would be intervention. So these are the different buckets that you could identify using procedure codes. And as I mentioned, we have several lectures that will go into how to use the procedure code book. If we do just a brief overview of what is the process of how do we even identify code? How would you even go about specifically looking at ICD-10-CM? So identifying a diagnosis codes, what do we do? So earlier I told you all that there were two parts. And make sure you're making your notes kind of as a heads up, and you should have seen that within the packet of information that you have access to, is that at the end of this course, you will take an exam. And that exam is to review these basic key components of coding and to make sure you are comfortable with the skills that have been presented in using both of your code books. So some of these things I would suggest taking some notes on, especially if you're new to coding or this is a refresher for you. So if we go through the process of coding, what would you do? The first thing is, remember, you always look up the diagnosis or the injury in the alphabetic index, and that is identified through a bold term that's called the main term. So that main term then would be identified. For example, if the patient has asthma, you would go to asthma, or if the patient had a fracture, you're going to go to fracture. That is the first thing that you're going to do, is find that main term. And for diagnosis codes, your question is, what is wrong with the patient? Okay, what did the patient come in for and being treated for? In addition to identifying the main term, there are some other terms. So if you've been using the code book and you're not familiar with these different conventions as they're called, we're going to get into our next lecture going into ICD-10-CM around the various conventions. And that is, once you find that main term, you're then going to scan and look for the subterms, so additional descriptors in your documentation, which could be the anatomic site, which could be manifestations, which could be the actual laterality, You're looking for that and any cross references, and actually to know where do I go from here. Now, within your alphabetic index, there always going to be a code, but remember that a code can have a minimum of 3 characters up to a maximum of 7. So here in this bold kind of capitalized letters here, do not code from the alphabetic index. Do not, do not. You're always going to go to step 2, and step 2 is to locate the code in the numerical tabular list. So once you find that code within the alphabetic index, you're going to go to the tabular list, look for that code. We're going to talk about what are some of the key things around what do you look for in the tabular around instructions and other kind of additional rules to follow to build the code to the highest level of specificity. And that means if you're going out to the 7th character. Also, consult any definitions or any guidelines, and we're going to talk about some guidelines and what they are. You then would assign the code, and specifically this, remember, you must stay in the same table. That is specifically to the procedure codes. We're going to get to that when we go over PCS coding. From there, you would be complete. So always remember, you don't go to the tabular list first. You do not code from the alphabetic index. This order must be followed to make sure you are assigning the correct ICD-10 CM code. The other thing that's important to keep in mind that we're going to talk about in more detail is I mentioned within that 3rd step is referencing coding guidelines. So coding guidelines are going to be guidelines that were created by several different organizations such as CMS, also such as NCHS, so the National Healthcare Vital Statistics, so NCHVS, okay. These organizations got together, another one could be the American Hospital Association, got together and actually reviewed the ICD-10 CM code book. They created something called guidelines that are updated every year. So there are some 2022 guidelines. Many times the guidelines is giving you the overall rules and standards to how the ICD-10 CM code book should be used. So it gives you some guidance to follow in the fact of if you assign this code, maybe you can assign this code. Or if you assign a code, what additional code you should have for that. It also gives you guidance when it comes to order of codes, because remember I said at the beginning of the lecture the importance of why do we even use coding, and one of those definitely was for reimbursement. So these guidelines a lot of times align to that reimbursement component. And many of these guidelines will apply when you are locating these codes for your trauma registry, and maybe some of them would not. However, it's important you understand because that's going to help you know how to correctly use the ICD-10 code book. So here's an example of a coding guideline when it comes to coding fractures. And we will talk about within the next lecture around certain keywords that you will see in your alphabetic index that is really guiding you to locate the correct code. So we will go into this table in more detail. I'm just going to go to the first box here, where one of the coding guidelines will be assign separate codes for each injury unless a combination code is provided. That's a guideline. From there, there could be 2 options. A multiple injury code should not be selected if supporting documentation is presented for the specific code. So here's a guideline. It's saying you can't just generalize a code. If it is specific within the documentation based on the guidelines, that is what you have to choose. So that is why it's very important that you scan those subterms within the alphabetic index to make sure you're being very specific to what's in the documentation and not generalizing a patient's condition just because that code potentially may be available. There are some key documentation rules when you're going through the documentation. When it comes to understanding what you should be picked up and what you should not be picked up when it comes to documentation. And this specifically is important when you are assigning the correct code for, and remember again, it's going to be based upon the purpose of assigning those codes. Now, the main purpose of this lecture is for you to get a general and a complete understanding of the ICD-10 CM code book. And I know that specifically for trauma, there could be some instances where you may look at a radiology report and then pick up specific information from that radiology report. However, remember that anything that should be documented around disease, injuries, etc., should come from the physician documenting that. And so this is what some of this key documentation is making very specific, that any of those diagnoses have to come from what was documented by the physician, not from the nurse, but for the physician. Okay. Just as a review over that ICD-10 CM code book that everybody should have and have it on your desk or wherever your work area is ready to go, is you're going to have a CM code book that's going to identify the diagnosis codes. You're going to have, and within that code book, there are two sections. There's an alphabetic index, and then there's going to be a tabular list. Within the PCS code book, you're going to have two sections, which is an alphabetic index and something called tables. It's going to be important that you use the most up-to-date version. Now, I know many of you may not have access right now to the 2022. If you don't, you should at least have the 2021. I am going to go through within these lectures and highlight some of the changes within the 2022, just so you can kind of note those, look those up and have those. And always keep in mind that updates are released every year. So every year in October is when these updates come out, and then there could be some modifications that then are released again within April. Okay, after there has been additional feedback around them, using these codes. Maybe there are questions, maybe it wasn't specific enough, and so then from there, there could be some addendums that could come out to the code book. Now I want to talk a little bit about a resource that will be free and available with updates every year, and that is ICD10data.com. This is a website where you are able to do a quick lookup of diagnoses as well as procedures. It includes coding guidelines where you may need to reference in the event, for example, if you're coding burns or if you're coding particular fractures, that will give you those instructions of how to use codes when it comes to displaced or non-displaced, based upon what is documented or not documented. All of this information is at your fingertips on this free website. There are also crosswalks that are available as well. So anything that you could think of that would be available within the code book is going to be available on this website. Some other things to keep in mind is that it is updated every year. So every year in October, those updates come out. If you go to the link down below, it shows where the website is. Please click on that if you are unfamiliar with this resource. You have it right at your fingertips. I know many times you may have older code books if you are using a hard copy versus the electronic version when you are coding. This allows you to have a reference that if those new codes have come out and you haven't been able to get a new code book, you can go to this website just to verify what those, if there are any updates when it comes to the particular code that you may be using. It's right there. If you're new in your position, this just adds another resource that you can use when it comes to assigning codes. Again, I want to say it is free, that you can go to this website at any time and use this reference. Each year, I will repeat again that it is update, and those updates do come out in October. One thing I do also want to point out is that it mimics the code book. However, it is not going to be the exact same format as you would see in one of your ICD-10 CM PCS code books. However, all of the same codes will be provided in this website, And so, as I mentioned before, it just provides you that resource. So I just wanted to point this out, kind of pause, allow you to kind of add this to your resources if you were unfamiliar with it. If you're somewhere, don't have access to your code book or the electronic version, you can quickly go to this website and look up a diagnosis or a procedure code. We've reached the end of an overview of really medical coding and specifically ICD-10 CM. As we go through each of these lectures, you will see at the end if there are any questions specifically around the lecture that you've heard. I will definitely state to write that question down and be very specific if it was a particular lecture. And this will allow to be more specific in your response of where you may have heard this information and need to have clarification on that. So the website is, the email address, excuse me, is education@pomfreyconsultant.com. Send any of your questions that you may have from this overview to this link and you will get a response. I hope you enjoyed the first part and you're ready to get into more detail.